So I'm Dr. Eric Friedman. I'm from Sonora, California, which is a little rural town out in the foothills of the Sierra Nevada mountains. And I've been a urologist for almost 25 years, so I've had a broad experience with doing various different office procedures and different types of anesthetics, and I've been able to introduce and successfully bring in the use of nitrous oxide to my practice. I've always been concerned when we give patients oral sedations. They come to the office sedated, they leave sedated for a number of hours or maybe the whole day. So I was always looking for something that would be a nice tool that we as urologists can fit into our tool belt that will help us. And I've been able to introduce and successfully bring in the Nitrouseal system, into the office.
You weren't anticipating, and you weren't thinking about the procedure anymore.
I was down far enough. I didn't feel much of anything, maybe a little pressure, and I heard the clicks. That was all.
Didn't really feel much of anything, so it was a very good experience.
Nitrous oxide has been around for such a long period of time already with this massive amount of data and safety in both pediatric use and in both dentistry that it's a very easy transition, to the office. The setup is relatively simple. I set it up with my my younger son and a couple of wrenches, and we put the whole thing together. I think it was within an hour. We wheel it out, when we need it. We set up an exhaust system. In our case, we just send it right into the drains. Any office really can replicate that, very easily. Patient degree of comfort level and the ability to completely have, their normal abilities to walk and talk and drive home if they want and that sort of thing. That's such an advantage. The patients see that.
It must have gone faster. Time, you weren't thinking about time or anything.
She takes it off and then she puts oxygen in there, and it takes about 2 minutes and you're back to normal. Keeps you relaxed and pain-free.
Well, I didn't feel any pain at all, and everybody was in a good mood, and it was very calm and very easy.
They're holding their own mask and tubing system, so they really have a sense of that they're in control. That puts their mind on what they need to be doing, which is holding the mask on their face and breathing. It's allowed me to do things in the office that I otherwise would have been sending the patients to surgery center or the general anesthetic. And so that was easy for me, but that's a lot of expense for the patient. And historically, I would say to the patient, look, it's hard to feel things, you're moving around. So now, there really hasn't been any cases since I've had the nitrous oxide that I have had to say to them, no, we're gonna have to do you in the operating room.
With it, it was enough to probably, go a thumbs up.
If I had an occasion to use it again, I certainly would if necessary.
I would definitely recommend it.
I just think it's a great product, and it's really helping our practice and allowing us to, help patients along.